All right, so thank you all for joining. Really appreciate you taking time out of your day. We're really excited to talk to you about the advancement in treatment of OSA and Inspire therapy. My name is Schalch Lepe. I'm with Inspire, and we are lucky today to have Dr. Schalch Lepe here from both two offices at UC San Diego Health and also Schalch Clinic in San Diego.
Hi, everybody. Thanks for joining us.
I apologize, one quick technical difficulty. My slides are not moving.
Share your screen.
Oh, there we go. Here we go. So as far as asking a question today, you can hover your mouse over the lower half of your screen, and you'll see the question and answer box here, and you can type in throughout the entire presentation. We'll try to answer questions as we are moving through the presentation. If there's questions still at the end, or if we think they need to be addressed with Dr. Schalch or our Inspire individuals, we will answer those as well. So just to get started, we're, like I said, really excited. We have two amazing people to talk about Inspire today and OSA in general, one being Dr. Schalch Lepe and also Karen Wolk, who's an ambassador for Inspire. Dr. Schalch Lepe comes from as an ENT here in San Diego from UCSD, a double board certified otolaryngologist, and also has a private practice at Schalch Clinic here in San Diego.
Thank you for the introduction, Shelly and the Inspire team, and of course we'll be hearing from Karen, the patient perspective, for Inspire, which I think for most of you will be, probably the most interesting portion of this talk. But certainly providing an overview of what obstructive sleep apnea is a good way to get started. Most of you probably will have already been diagnosed with sleep apnea. Some of you might be in the process of doing so, but in general, of course, obstructive sleep apnea is the obstruction of the airway while you're sleeping. That will be sort of the most comprehensive or general definition that we can talk about. As you're laying down and as you fall asleep, in particular as you drift into a more deep stage of sleep, the muscles eventually start to relax. And these are all the muscles in your body except your diaphragm that keeps your lungs moving and keep you breathing. So the muscles around the throat and in the back of the tongue start to relax as well. And if you're prone to having obstruction of your airway will eventually start to experience collapse, and then the flow of air will cease or become at least very difficult. And one of the symptoms, of course, that goes with that is the snoring, right? It's that loud passage of air through the airways. This picture here shows how the palate is collapsed in the back of the throat and it's making the passage of airway difficult. So that's the basic principle of obstructive sleep apnea. And that's, what we aim to treat, of course, by means of a number of traditional and, of course, more cutting-edge alternatives for those patients that do not benefit from CPAP therapy. And so it's a very common problem. As you know, the awareness has increased significantly. And then we know that it's, of course, over 20 million Americans at least that suffer some degree of obstructive sleep apnea. We can move on to the next slide now.
We could if my slides were moving forward. I apologize.
No problem.
We've got some stuck buttons here. You might be able to move them from yours, Dr. Schalch Lepe.
Let me see if I can. I will take over the screen sharing here and see if that actually works, but no, that's not working, unfortunately. So hold on 1 second.
Oh my God, that's mine.
You should probably take over controlling.
I'll take back over. I apologize for those who are here. I know you took valuable time out of your day. Let's see, it'll.
Says you have the presentation in your computer, so I don't have the slides to share. Okay, there it is.
Okay, but it is not letting me move forward. Oh, here we go. There we go. Oh my gosh, I'm so sorry.
Excellent. So the figure here that you see on the lower right-hand corner basically is just a typical tracing of someone that is breathing, and then all of a sudden the breathing ceases, and then the oxygen levels drop to 84%, and then that patient experiences what's called an arousal, where the patient kind of is brought back to a more superficial stage of sleep, and then the breathing becomes accelerated. The patient experiences gasping and choking for air. The oxygen levels recover, and then of course you drift back into a deeper stage of sleep, and the cycle just basically keeps repeating itself, putting a lot of stress in your cardiovascular system, in particular your heart, your lungs, your circulation, and of course increasing the risk for complications and problems related to that. We can go to the next slide.
Sleepiness on this computer. I don't know what is happening.
Okay, there we go. Perfect. So the consequences or the symptoms or the impact that sleep apnea has, of course, include a number of things: fatigue, diminished productivity, just basically feeling tired and sleepy throughout the day, obviously, because you're not experiencing a good quality of sleep. There's an effect, of course, on the people that are around you, your loved ones, your bed partners, your spouse, because of the snoring, of course, and the lack of sleep, and the disrupted sleep also affects your bed partner. The increased daytime sleepiness, of course, can increase the risk for accidents, industrial accidents, car accidents, etc. And then, like I mentioned, the impact on your cardiovascular system, on your brain health, including, of course, decreased memory and inability to concentrate, headaches in the morning. Sleep is so important that anything that affects it or interrupts it will have any number of consequences in your health. That's something that's definitely worth keeping in mind. So when used regularly, of course, CPAP has been the mainstay of treatment for decades now. The basic principle of CPAP is keeping the airway open by means of air pressure. Using this air pressure, the airway remains open, and the individual is allowed or able basically to move air in and out of their lungs, keep the oxygen levels up, and then prevent the consequences we already mentioned that come from sleep apnea. The reality, of course, is that CPAP, is not for everybody, and not many people can tolerate it or keep it on consistently throughout the night. And that's why, of course, we explore alternatives to CPAP. In the next slide, we see that there are, of course, other alternatives, such as oral appliances for certain individuals that might qualify for them. Oral appliances, at least per guidelines, are typically indicated for mild to moderate obstructive sleep apnea. And the goal of the oral appliance, again, similar to CPAP, is to basically keep the airway open and keep it from collapsing. Oral appliances, of course, avoid surgery, so it's a great option for whoever has the right sort of anatomy and dentition to support them. But there can also be, side effects from them, or short-term or long-term consequences from wearing them, including TMJ pain and some orthodontic issues. So, as great as they are, they're not necessarily for everyone. Now, conventional surgery for the upper airway has been around for a long time. The surgery was basically aimed at either removing certain areas of obstruction in their airway, or at least stabilizing them to keep them from collapsing. Some surgeries involve modifying the skeletal anatomy of the base, of the maxilla, of the mandible. So, with varying degrees of success, these surgeries can certainly be options as well. But once again, they don't necessarily apply to all patients, particularly the ones that have more severe sleep apnea. It's been observed that the success rate is not as high. And even if there's a successful short-term outcome, that doesn't necessarily mean that there will be a successful long-term outcome. Sleep apnea, unfortunately, can come back as the patient perhaps gets older, or their weight changes, or other medical conditions are added. And that's why up until recently, we were just basically very limited into what we could achieve with just conventional upper airway surgery. And now, of course, we have Inspire. Inspire is a very exciting treatment modality that's basically a hybrid between medical management and surgical management of sleep apnea. And I'm going to explain exactly what I mean by that, because this is more a multidisciplinary program. It's not just the procedure, but it's basically the procedure in combination with the sleep partnership that will take care of adjusting and following the therapy over the lifetime of the individual to try to achieve the best possible outcome, not just in the short term, but in the long term as well. It's an outpatient procedure that involves implantation of the device that you can see on your left-hand side. Anybody that knows anybody that has a pacemaker, or you yourselves have a pacemaker, you'll see that the device looks basically identical to that, except of course it's not working with your heart, it's working with your breathing. The device is activated by means of a remote control, as it's being shown here on the right-hand side, and it's programmable, it's adjustable. It has a battery, just again like a pacemaker or some other implantable device. So the battery has a certain half-life of about 10 to 11 years. So of course, those battery changes are required. But more importantly, of course, is an option that can be adjusted and will follow the individual along throughout their lifetime in order to have the proper level of stimulation to keep the airway open at all times. That's what's very important. The diagram here shows how or where the device sits on the right upper chest for most people. It has a breathing sensor that senses the movement of the chest when the individual is sleeping. And that basically sends a signal to the device that then stimulates a very important nerve in the neck called the hypoglossal nerve. This nerve is responsible for moving the tongue forward and for dilating the muscles in the throat, and thus keep the airway open, not by air pressure like CPAP would do it, but by stimulating the muscles from the inside and then achieving basically the same outcome. So that's what's brilliant about Inspire. We achieve the same effect that CPAP would, but without the need for putting a mask on and having to deal with the air pressure and all the other potential problems that CPAP might have. It does require 2 incisions, and the device itself is connected to the lead up in the neck under the skin. So the cable is hidden under the skin. The procedure is outpatient, like we mentioned. The battery life is about 11 years. And more importantly, and this is an exciting development from a couple of months ago, now this device is actually considered to be MRI safe. There are no limitations in terms of the body parts or areas of the body that can be imaged by means of magnetic resonance imaging. The office visit, of course, and this is not taking into account, of course, the preoperative workup leading to the implantation. But once the implantation is done, the patients are brought in for what we call activation, and then to establish the initial settings to ensure that the patient's comfortable with the stimulation. And of course, we keep very close track of the results, the effectiveness, and how this is basically keeping the airway open. There's training involved, of course, in how to use the remote, how to set it up, how to troubleshoot any issues. And then that's when in a way, in a matter of saying, this will be kind of in the patient's court to sort of adapt to it and get used to the therapy, acclimate to it, and then eventually start, of course, benefiting from it. So it's a multi-step process. It's a multidisciplinary program. It's not just a procedure, but it's really what comes after. That's so important, and that close collaboration and work with the sleep medicine specialists is what ensures that we have, of course, excellent outcomes with our patients. You can see here that there's plenty of data to support its sustained benefit in terms of reducing what we call the apnea-hypopnea index, which is that very important number that we use to confirm diagnosis of sleep apnea. You can see here for a very large cohort of patients that has been there's been ongoing follow-up for this group of patients that have the implantation done. You can see this update from 2018. You can see that the sustained improvement from 29.3, which would put you almost in the severe category, all the way down to 6.2, which basically puts you in the mild, borderline negative category for sleep apnea. And this corresponds to almost an 80% reduction in the AHI. You can see that there's also, of course, significant improvement in terms of, quality of life measurements, which are obviously so much more important, right? That's the real life impact that you're experiencing from the sleep apnea. You can see that from the bed partner's perspective, for example, the snoring decreases substantially from 83% baseline all the way down to 10%. And we point out snoring. The snoring sometimes is the symptom that kind of gets you in through the door, right? That's the main symptom that everybody's really bothered about. It's one symptom only of a variety of other things that happen with sleep apnea, but of course we take it very seriously. And even though Inspire is not necessarily, we don't label it as it's a treatment for snoring. No, it's a treatment for sleep apnea, but oftentimes the snoring improves together with it. And now we know that we're treating, of course, the potential impact on your cardiovascular system, but we're also controlling the snoring and some of the issues that affect not yourself, but also your bed partner and your significant other. The patients like it. I mean, our program is in a way very strict in terms of patient selection. We want to make sure that our patients are motivated, that they have tried and failed CPAP, that we have almost exhausted every other option. But once we move forward and we get them in our program, patients are very satisfied. The feedback we get as the patients adapting to the therapy and starting to benefit from it tends to be very positive. And more importantly, for that reason, patients are using it. They just like with CPAP, this therapy is only as good as the use you give it. So if you don't turn it on and if you don't activate it, then of course you're back to square one. And we can see that patients that have Inspire, and have undergone the procedure, for the most part, are adhering to the therapy and are turning on their device as well. The questions that used to come up very frequently just a couple of years ago were, of course, in terms of insurance coverage and things like that. And thankfully, once Medicare got on board, and now that we've had several years experience with it, most insurances cover it as long as all the criteria are met. And we will talk about those criteria and those indications for the procedure. So thankfully, insurance coverage for the most part is not an issue at all. We keep referring to this procedure or this technology as new, but if you go back in time, this was actually approved by the FDA in 2014. So we're almost at the 10-year mark of this technology being around. So thankfully, not just in our program, but nationwide and worldwide, actually, there's an increasing experience with it, and we've learned so much about it, and we continue to be very excited about it. The indications for Inspire, you have to have at least moderate obstructive sleep apnea, and it has to be obstructive, differentiating it from central sleep apnea, which is in a way a different type of disorder that doesn't involve airway obstruction. So this is indicated for obstructive, and the AHI has to be at least 15, at least for most insurance carriers. The upper limit is not necessarily a hard stop. We've implanted people that are more severe, and they also benefit from Inspire. But the key here is that you have to have tried and failed CPAP. It's not a rite of passage and let's just go through the motions, but it's really that sets the stage for someone that's truly motivated, that has tried and exhausted all possible treatment options, and that's truly motivated to work through the process and then with the sleep medicine specialist to acclimate to the therapy and get the most benefit from it. So that's, at least for our program, an absolute requirement. You have to have tried and failed CPAP, and we will go over the reasons for this. And if we feel, circling back to giving it another try is what's indicated for proceeding with Inspire, we're the first ones to say so. So it's important to keep that in mind. The weight limit is also somewhat of indication that's a little bit in flux. In general, what we call the body mass index, which is the relationship between the height and weight, shouldn't exceed about 35. Some insurance carriers have a hard stop at 32, but we know that patients will definitely benefit if they reach, even if they're at the level of that sort of BMI of 35. And that's something we will work with you very closely, and perhaps work with your primary care doctor in some weight loss to get you prepared for this. We want to make sure that you get the best possible outcome, and of course, weight loss is it's an important point in your health, not just from the sleep standpoint, but in general as well. The airway anatomy exam needs to be passed, and I would like to talk about that a little bit in great detail, because in order to meet criteria for Inspire, you have to undergo an exam under anesthesia of your airway. It's like a mini endoscopy for those of you that have had an endoscopy of maybe your stomach or your colonoscopy as well. You're put under anesthesia, you fall asleep, and then we use a flexible camera similar to the one we use in the office when we examine you in the office while awake, to look at the anatomy of the airway and make sure that you meet criteria for Inspire as well. So it does require a preliminary procedure that does involve a trip to the operating room before the actual implantation of the Inspire takes place, and that's important to understand as well. And then as it stands right now, it's still only approved for adults, although I'm learning that it's going to be expanded to pediatric indications very soon as well. But our program, of course, is geared towards adult patients at the moment. So next, I think we're going to be looking at Karen's story and her testimonial. I think you're going to find this absolutely fascinating, and I'm going to let Karen take it from here.
Hello, Karen. Are you still on? Oh, it looks like she fell off. So let's hope she calls back in. She's as important as our wonderful physician here to give you kind of the backstory. I guess in the interim of Karen getting back on, maybe what we can do is go to the question and answers and answer those live, Dr. Schalch.
Perfect. Okay, so we can circle back to Karen. If we can maybe just move forward in the slide here.
So does the treatment help with memory loss? Watched another Inspire video, and one woman gave a testimonial that 3 to 4 months after she got the implant, her memory improved.
I see. Well, it's certainly an indirect benefit, but just to be very clear, that's not the indication for the Inspire. The indication for Inspire is treating obstructive sleep apnea. But we, of course, know that patients that have had obstructive sleep apnea for a long period of time will have cognitive decline, issues with memory, issues with concentration and focus. So an indirect benefit of getting the sleep apnea under control would be to improve someone's memory and cognitive ability. So yes.
Are the percentages for someone who have never, what are the percentages for someone who's never used a sleep apnea machine?
Not sure if I understand the question correctly, but if we're talking about, the way I would answer this question is, we compare efficacy between CPAP and Inspire. The way I answer this question is that it's just as effective and it's just as successful in treating sleep apnea, provided, of course, someone is using their CPAP, keeping it on all night, using the correct pressures, using the properly fitting mask, and being able to tolerate it night after night after night. So it's absolutely comparable and just as good as CPAP, as long as CPAP is being used correctly. And once again, I emphasize the requirement that you have to have tried and failed CPAP before being able to move on to Inspire.
Karen, are you able to? Oh, let me.
Yeah, I think I can.
Excellent.
Can you hear me?
Yes.
Okay. Yeah, I got kicked off right there, so I just wanted to make sure. So my patient story kind of starts with getting diagnosed very late on in my sleep apnea disease process. I didn't get diagnosed until my mid 40s, but turns out I've had sleep apnea my whole life. Before Inspire, my AHI was 20.6. I would like stop breathing up to 74 seconds at a time, and my oxygen saturation would go down to 82%. I tried CPAP for a year, and then I tried BiPAP for another year. I had nasal turbinate reduction to tolerate the mask. I did cognitive behavior therapy for insomnia and nightmares from the masks. I was having lots of symptoms, which actually I started having symptoms about 5 years before I actually got diagnosed with sleep apnea, starting with memory issues, word finding problems. I would get lost while driving. I also was having daytime sleepiness, found myself even at my worst falling asleep while talking, couldn't follow even a television program. I couldn't follow along or understand what was going on. So I'd have to watch stuff over and over again. Had trouble retaining knowledge, had trouble, but my word finding issues have impacted me a lot at work, because when I was doing trainings on new electronics products, because I was a sales trainer for an electronics company, and couldn't remember words, very simple words, and it was very difficult to continue to work. So I went on work disability, and I eventually got diagnosed with a mild cognitive impairment. Shortly, it was about a year before I got Inspire, and my doctors told me that if I didn't find a treatment that was gonna work for me, that I most likely would end up with dementia in about 5 years. And lucky for me, found Inspire. And after getting Inspired, that AHI went to a 4. The first night of sleep after activation, I noticed a huge difference. I was able to get restorative sleep for the first time in my life, and that was very exciting. And then 3 to 4 months down the road, my symptoms of the mild cognitive impairment started to lift. And you know, not everything's perfect, but it's much better than it used to be. And now I am working full time and able to travel. I'm about 4.5 years in. And I volunteer to talk to patients as a patient ambassador, because that's something I promised myself and my doctor when I went to get the procedure, that if this thing works, I'm going to tell everyone about it. And over the last 4.5 years, I've had my device reset a couple times because as I'm aging, the device is able to be reset to work with how my body is changing. And like as my airway, the muscles in my airway are relaxing, can have the device reset, because there's literally lots of settings to customize it, and they're all comfort settings. So I just recently had my device reset for the second time, and I'm finding it to be extremely helpful because found a really nice, comfortable setting where I can work within the minimum and maximum levels that they set up with my remote control. So if I gain weight or lose weight, I can change the settings, change the amount of stimulation to move my tongue gently out of my airway. And all that it does is every time I inhale or inspire while I'm sleeping, it gently nudges my tongue out of my airway. And that is something I cannot do for myself. And without Inspire, which I've only had 2 nights in the last 4.5 years that I didn't have my device on, without it, I have apnea just like I used to. With it, I've used it over 8 hours a night for all of those nights. It's like a new chance at life, because while I'm, breathing well when I'm sleeping, that means during the day I'm functioning, on all cylinders, and being able to focus on living rather than just surviving. Before, I was in fight or flight all the time at night, and it just, wreaked havoc on my life during the day. So I'm very grateful to be able to not only be able to talk to you, but also, able to function out in the world. And then I'm happy to answer any questions And by the way, the AHI of 4, that brings my oxygen saturation at the lowest I am now is at 90%, but I'm generally well above that. And so thank you so much for having me on, and sorry for my technical issues. I think my hotel internet isn't very good.
I think it's the day for technical difficulties, but ground since that's what it happens.
It is Groundhog Day.
So Dr. Schalch, there's a couple more questions. Karen, thank you so much for your story, and we really appreciate you doing this, taking the time out. This is an unpaid gig of yours, and we're super appreciative. And I know that the participants on the call really do as well. So thank you.
Thank you.
Dr. Schalch, I think there's a few more questions. Are you able to read those?
Let's see here. For, of course, individual cases, for previous diagnosis of sleep apnea, this can definitely be an option, provided you meet all the criteria, and we'll be very happy to sort of review your case on an individual basis. There's a question here about, someone's kind of like on the younger age, if this is indicated, of course. I mean, if you're an adult and you have a diagnosis of sleep apnea and you're unable to adhere to CPAP, I mean, this can definitely be indicated for you. Now, a question we sometimes get, and this is not only true for Inspire, but also for other implantable devices, cochlear implants, other types of nerve stimulators. I mean, what if the technology improves, or what if there's a new device that comes out, years down the road? Well, when that time comes, if it's indicated, with the next battery change, you can get an upgrade and get a new device or the latest version of the device. I mean, nothing precludes that from happening. And that's true for, again, any implantable technology that's out there, for medical use and otherwise. So that shouldn't discourage you to seek treatment for your condition now, because of course, until that technology comes into play or gets FDA approved, sometimes it can be years, if not decades. And in the meantime, the disease will continue to affect you and wreak havoc. So, you don't want to sit on this for too long, just with the expectation that maybe there's going to be something better out there. So I think that's an important point. And once again, of course, thank you so much for Karen for her very powerful testimonial and experience. I mean, I think it's just amazing. Okay, perfect. So there's one more question. I mean, what does it mean, that there's about 6% of patients that are unsatisfied or dissatisfied? Well, like with once again, with any therapy or even any surgery, there's some people that just fail to acclimate to the therapy or take longer to acclimate to it and find that they're having benefit from it. That, of course, is something that can happen. Our program is very much focused on selecting the right candidate and really looking at every possible variable to make sure that anybody that's going to move forward with it will have the best possible outcome. But like with any other type of therapy, there might be someone that just doesn't acclimate or takes maybe longer, and that could explain sometimes for those decreased satisfaction rates. And that's something that you, of course, should be aware of.
Dr. Schalch, I wanted to mention something that I thought about when I myself was looking at patient satisfaction rates, and it reminded me of the compliance rate for CPAP, and that's such a drastic difference in numbers, with like maybe a 50% compliance rate, and how much better it is, and it is a second line therapy, and that, being that CPAP is the gold standard, there are a lot of people that I myself look great on paper with my CPAP compliance and using it, but I wasn't subjectively feeling better, and I wasn't tolerating it.
That's completely correct and absolutely spot on, in terms of the adherence rates with CPAP, and even, some patients that do take on CPAP for therapy. I mean, there's a high abandonment rate after, a period of time. And sometimes if the CPAP is perhaps solving the airway obstruction, but instead causing other types of problems like difficulty sleeping or other issues related to that, then you're basically changing one problem for another. And that still doesn't help you as an individual. So those are all things worth keeping in mind. And like you said, percentage-wise, I mean, this really compares a lot more favorably, at least for the patients that have, gone on and gotten implanted with the right indications.
I think there was a question, Dr. Schalch Lepe, regarding AHI. I don't know if we fully covered. I know it was earlier in the presentation a little bit, but just another explanation of the AHI.
Yes, so the AHI is just that variable that we look for in the sleep study that counts the number of times you either stop breathing or your breathing slows down to the point where your oxygen levels start to drop as a result, and then that's counted the number of times during the hours that you're actually sleeping, and that creates this measure, called the AHI, or apnea hypopnea index, that establishes the severity of your sleep apnea, and of course clears the way for indications for therapy, whether it's CPAP, oral appliance, surgery, or perhaps Inspire. And that's all. Basically, the one number that we pay a lot of attention to, of course, whenever you have a sleep study done.
So some other, is there a protocol to follow if we need general anesthesia in the future?
Yes, I mean, like any other implantable device, this is something that everybody's made aware of it being in place, and there's certain precautions that need to be followed. But general anesthesia is not contraindicated with Inspire in place. Certain use of electrocautery for surgery is recommended to be limited in order to prevent damage to the implantable device. But in general, you can have any other kind of surgery without any specific risks that are related to it, as long, of course, as your surgeon and your anesthesiologist are made aware that you have this device in place, similar as someone that would have a pacemaker.
There was a question about cost, and just so you're all aware, obviously that's going to depend on your particular insurance and your deductibles. But when you make an appointment, we can also figure some of that out, and be able to tell you specifically to your insurance.
All right, that's all determined, once the visits take place and the process gets going. So that's something that we can look at individually. So now you're going to talk about the app, correct?
Yeah. So regarding the app, it really makes a great deal of sense. We answered a few of your questions today, but there's a lot of information on the Inspire Sleep app, to include Inspire stories like our ambassador Karen that spoke today, more about the procedure itself, how it works, is it right for you, and then how to find a doctor locally. So really makes sense to spend a few minutes and download the app. It also allows, if you get the procedure, there to be some ability for you and your doctor to kind of monitor your therapy as throughout your years on Inspire. And then lastly, here's Dr. Schalch Lepe's information. So please take advantage of the phone numbers if you want to call and set up a time to answer additional questions with the consult.
Thank you so much, Shelly. Yeah, please feel free to reach out. I mean, we will contact you and go over a number of things, get you in for an appointment, and then help you establish, if you're not already established with one of our sleep medicine partners, which oftentimes you come to see us once you've already seen the sleep specialist. But if you haven't, we can certainly help you establish with one, complete your evaluation, and then move things forward if this is the right pathway for you. I think it's a exciting technology. We're firm believers in its efficacy, and our program thankfully has been very successful in terms of outcomes, and we look forward to helping out any patient out there that might be a good candidate for it, that's motivated to pursue this.
Thanks again for everyone taking their time out of their busy days. Dr. Schalch Lepe, thank you so much. Karen, we appreciate what you guys do in educating on OSA. Take care, everyone.
Thank you, everybody. Thanks so much.
Thanks,
Thanks, Karen.
Thanks. Nice to see you. Bye.